Some important recommendations just released about hormone replacement therapy for women.
It comes from the U.S. Preventative Services Task Force, which makes recommendations about medical prevention. CBS 2's Dr. Max Gomez here now with the information that has to be read carefully, Doctor.
That's right, because it'll be very easy for these recommendations to actually be misinterpreted. Now, those recommendations, this recommendation it's recommending against hormone replacement therapy, or HRT, for prevention of chronic conditions in postmenopausal women, which still leaves lots of areas where HRT may actually be beneficial for many women. Angela Bianco started taking hormone replacement therapy, or HRT, about 6 years ago because, like many women, she was having some difficult menopause symptoms.
Hot flashes, mood swings, irritability. My cognition wasn't as sharp.
This despite the fact that HRT got a bad name in the 90s with publication of the Women's Health Initiative findings, which said that the risks of HRT, especially breast and uterine cancer, outweighed the benefits. Those findings have since been revised and at least partially retracted.
Over the 18 years of follow-up, there was no increase or decrease in the all-cause mortality rates.
What was less clear was whether HRT was useful in preventing certain chronic conditions, such as reducing the risk of fractures and potentially diabetes. The U.S. Preventative Services Task Force evaluated the scientific evidence and recommends against using HRT as a preventative for chronic conditions in women who have already gone through menopause because their risks exceed the benefits. That's a very specific recommendation that experts say should not be interpreted to mean that HRT should not ever be used. It has to be individualized based on a woman's own risk factors.
A family history of cancers, their medical problems they have, whether they're smokers, whether they're obese, and family history of heart disease, osteoporosis, blood clots.
Which is what Angela Bianco did, and she's very happy with her HRT.
I felt sharper, and my usual stable mood returned, which my husband was happy about.
Now, the HRT risk-benefit equation can be complicated. Has a woman gone through menopause? Does she still have her uterus? Are we talking about estrogen alone or estrogen plus progesterone? All of these factors are important for prevention and menopause relief. And, of course, you've got to talk to your doctor about those make it an individual decision. And there are actually some new medications out there that act kind of like hormone replacement therapy, but they're actually much safer as well. So it's even more complicated. You got to talk to your doctor.
If you can find a solution, though, it does make a happy home.
Yes. It's a happy wife, happy life, right?
You know it.
Thank you, Dr. Max.
All right.